Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. Happy birthday, Botox. 20 years since FDA approval for lines and wrinkles and so many other things. I want to take a second and tell you a little bit about my personal journey with this. So, in about 1997, I met Gene and Alistair Carruthers. They were the people that are credited with discovering the cosmetic effects of Botox. And because of my relationship with them, I became a member of various advisory boards. And I am a member of the International Botox Advisory Board. And I was lucky enough 2 years ago to tour the factory in Westport, Ireland. And I'm obviously very involved with this. This is just a fraction of our Botox vials. And I'm pretty sure I was the second person in Virginia to ever use Botox, okay? Second person. And why do I say, how do I know it was the second person? Because everybody else said they were the first, okay? That's how. And no, I'm sure I wasn't the first person, but I was certainly an early adapter and one of the first practitioners to offer this. And I had a newspaper article when it was such a novel situation that the newspaper did an article on me, as you can see, and administering Botox because it was this pretty poison and something that we had never seen before. There was no treatment for lines and wrinkles and all of the other things that Botox cosmetic is used for. And when I started doing this, and again, there weren't many people around doing it, and when I knew that this was really going to be something big is when I walked, I was in the office and my staff said, you have a Botox patient, but they were, you know, you work with these ladies all day and they had this little body language like something was up. And I walked in the room and you can see in this picture, there was a patient who was blind and had a seeing eye dog and she wanted Botox, okay? And she told me that, you know, even if you can't see yourself, you want to look and feel as good as you can. And that really impacted me on several levels. I ended up doing a facelift for her, and we did it at no charge because she was such a great patient. But if somebody that is visually impaired and they're going to do Botox cosmetic, I knew this was just really going to go somewhere. So we have been a diamond provider as long as they've had that category. So that's the top 5% in the country, and we've been as high as the top 3%. So it's such a popular procedure. We use it for, you know, obviously the lines and wrinkles, for masseter hypertrophy, for neck bands, for migraine headaches. I have two sons with cerebral palsy. They get Botox for spasticity. And it's just, I think in 1,000 years, people will still be talking about this drug because there was never anything like it. It remains the #1 neurotoxin and the most popular cosmetic surgery treatment in the world. So I want to give a big shout out and a happy birthday to Botox and all of my friends at Allergan and our rep Courtney. And I inject this, my staff, my injectors, Jenny, Breeden, and Eve also inject. So it's a big part of our practice. As you can see, happy birthday, Botox. I'm Dr. Joe Niamtu, LoveThatFace.com. Compared to normal families, our life is very, very different. We live in a very different world. They told us that having 2 children with special needs would be like winning the lottery twice. And unfortunately, those were the odds that we got. And now it's our family, and it's a family that I draw strength from every single day of my life. When I walk into the bedroom every morning and kiss these guys, you know, good morning, you know, they can't say anything to me, and you know, they may look up and smile, but that little contact right there, that just gives me strength and adrenaline and gets me through my day. They're really tough and they're amazing. But probably the most amazing person is April, my wife. She treats them like normal children. She dresses them up for Halloween, you know, for Christmas, little suits and ties, and And she makes sure that their life is as normal as it could be for children with disabilities.
Joey here, he is my quiet, very pensive, very cerebral boy. He loves to listen to people, especially new voices, take in what's around him. I think that my husband thinks he would be a linebacker, but I truly think that he would have taken after him and become a doctor or a teacher or something in that nature. Evan, on the other hand, he is my firecracker. He would definitely be into sports, always trying to get Joey into trouble because I think he's my mischievous one. But when it comes to movies, this little boy loves anything that's beat him up, shoot him up, blow him up. Vin Diesel, The Rock, Fast and Furious, Transformers, those are all his heroes.
Joey and Evan have spasticity in their upper limbs due to their cerebral palsy, and their muscles are flexed and tightened continually. This causes their arms and hands to be in awkward positions, and that makes it hard for caregivers, my wife and I and all our great nursing staff, to move them or bathe them or do even the most simple tasks.
Joey especially has problems with his hands. We started noticing his pinky and his ring finger curling more rigid towards the palm of his hand. And we could tell every time we tried to open his hand, the tendon was getting tighter and tighter and tighter. So Joey tends to curl up his hands really tight, and he wants to keep them there for extended periods of time. And in doing so, moisture builds up. And when that happens, it could lead to serious skin breakdown.
You know, having two children with disabilities, it's a 24/7 commitment. Somebody always has to be there. And they've been through so many therapies over the years. And again, so frequently I'm at work and it's April that has to drive the handicap van and take them there. And just what are some of the therapies either that they've gone to or that the therapists have come here?
They have received, since they were infants, physical therapy, occupational therapy, speech therapy. It was very special the way the therapists work with the boys and all children with special needs. It's really touching to watch them do their job.
As a cosmetic surgeon, I'm very familiar with botulinum toxin, but I have to admit I never thought I'd see the other side of it, the use for therapeutic indications. But I know how it works. So I was proactive in looking for someone who could assess and treat my sons with Botox for the spasticity in their upper limbs. So Botox has been an important treatment option in the management of my sons, both of them, their upper limb spasticity, and it truly has made a difference in their life.
And in ours.
And in ours, and we're very grateful to have that option.
One of our favorite activities is when Daddy picks up his guitar and starts playing for the boys.
So although Joe's played guitar with a couple famous people, his biggest fans are Joey and Evan. And when he strums that guitar, they just start laughing and smiling.
When I play guitar, everybody starts laughing. Okay,
No,
not that good now. Come on, no. It's one of the things that we do, and
it's just one of our special family time.
Have fun with them. So as an expectant father, having a son, I was excited, like all fathers are, to teach their sons how to throw a football, go hunting and fishing. Our life was very different. We spent it in emergency rooms, ICUs, doctors' offices. Our normal is very different from other people's normal.
But for me, my sons are absolutely perfect. I'm no different than any other mom. I love my sons deeply and will do anything for them. We try to do what normal families do, and we live. We're lucky to have the help, the physical therapy, and all the support organizations. We also feel very fortunate Botox has made a difference for our boys.
You know, we're pretty familiar with the special needs community. Here we do a lot of work and a lot of volunteer work. And I've heard people say that special needs parents are really tough, and they are, and you have to be. But really, my sons are the tough ones. I mean, those guys are Navy SEALs. And I think I said earlier that although they never have and never will be able to say a single word, they have taught me a lot about life and about love. They have.